My presentation tonight, tuning in, not tuning out. Giving permission to feel. If you look at our society today, it's the messages that we get out in society today is that it's not okay to feel sad, not okay to be angry, definitely not okay to be angry. And so the reason why, so it's important that if you look at what's going on, there are a lot of kids out there. I'm in private practice. I see not only kids but adults, and the common theme that I'm seeing throughout my practice is that people are not wanting to feel. And as a result of not allowing yourself to feel emotions, this actually is causing a lot of problems for us. I just wanted to acknowledge a few things before I start the presentation. When you see people that have had the experience of cancer, it's probably one of the most incredibly overwhelming experiences. So as a health practitioner, when you are seeing clients and they are in the recovery of cancer or going through cancer, the biggest thing that they really need at the beginning is for you to validate those experiences that they've had. It's important to actually acknowledge the feelings that they're having in relation to that experience. And we need to normalise all these feelings that the client's actually having. And I'll talk a bit more as we go on. And the other part is really important, is to find a new normal, because nothing ever is normal again after an experience like that. Knowing that you could die, it's such a big, incredibly overwhelming experience. So just a bit of an overview of what I'll be talking about tonight. Looking at the stress-disease connection, personality features and health-related issues, the connection between body and mind. I could spend probably 2 hours talking about that topic. And what goes on in the left and the right sides of the brain in terms of our thoughts and feelings. A technique called body focusing, which is a really incredible technique in helping people heal their pain. Common psychological traps. There's a secret to leading a fulfilling life, and some take-home messages. So Gabor Mate, when the body says no. The connection, exploring the disease-stress connection. In it, as a clinician, he actually, in 25 years of clinical practice, including a decade of palliative work, he used to ask clients this one question. When, as a child, you felt sad, upset or angry, was there anyone you could talk to? Or even when he or she had triggered your negative emotions? And the answer to that question, there was never anyone ever that could say yes to that question. That's incredible. In all the years that he worked with patients, not one client said, yes, I had someone that was there to help me with my feelings. So, some personality features and health-related issues as well. So these are sort of some factors here that actually can generate an enormous amount of physiological stress. So the first one. What do you think the first one might be? Repression of what? Absolutely. So our emotions are basically energy in our body. We have energy, all of us have energy in this room, collectively. We've all got this energy. Every one of us has energy. So when we push emotions down, That energy gets pushed down into our body and it can become very heavy. Inability to say what? No. Now, this is as a result of years and years of research through Gabor Mate in this book, When the Body Says No. These are the factors that he came up with. The lack of awareness of one's what? Anger. Particularly women. Always wanting to please. No matter how bad I'm feeling, I'm just going to keep on going. I'm just going to keep on pleasing. And not really acknowledging one's own needs. That's a really big one. Unable to say no. Number 4. What do you think that word might be there? What are unexpressed? Yeah, emotions and feelings. And what's ignored? What do you think is ignored here? If you look at as a child, what does a child need? They need validation of their feelings. So what is actually ignored here? Needs. You need that safe, secure, loving environment. And if you don't have that, it's going to really affect you adversely later in life. The other one, gentleness is, what do you think might happen when someone is really gentle and very giving and always giving? Sorry? Yes, spot on. Gentleness is exploited. Now this is really important for carers, and I'll talk a little bit about the carers later, but I'll just mention it now while I'm thinking of it, is that carers, they tend to lose themselves while they're caring for others. And it's really important that people notice that. If people are doing too much, there needs to be someone that puts their hand on the shoulder and say, hey, hang on, you need some help. So these factors here, over a long period of time, if you're experiencing this over a long period of time, what happens is it really harms your biology. Your whole being is harmed and really puts you out of balance and ultimately negatively impacts on your immune system. And it's easy, you're much more prone to get illness, physical illness, if those sorts of factors are in your life. Keep going. Connection between body and mind. Biologically, as human beings, what are we meant to be? Are we meant to be thinkers or feelers? As a human species. Thinkers? Actually not. Feelers. Yeah, you know, the gut feeling, the second brain, that's actually got more neurons than from the gut to the brain, it's actually more neurons from our stomach to our brain than the other way around, from our brain to our stomach. And where is the mind located anyway? Where is it? Is it in our head? Is it in our head? Is it somewhere else? Just keep that in mind. We'll answer that later. From the age of 0 to 3, what part of the human organism are children in? Are they thinkers or feelers? From 0 to 3? Feelers. That's all they're in. And if they get disrupted in that period of time, then there's likely to be, there can be lots of problems in terms of shutting down feelings. If you get told at a very early age, it's not okay to cry, not okay to show that emotion, you will quickly learn to shut down. Very quickly. And repress all that emotion. So let's look at the left and the right brain. The left brain is where we have our thoughts. And our thoughts come from past experiences and what people have said to us. This is the sort of monkey side of the brain. You know, we tend to think that we have thoughts like, I think this and I think that. But in actual fact, we don't actually actively think. Thoughts just come to us. We get bombarded by thoughts. And it's this part of the brain where we can create lots of problems. And for a person that's just coming out of cancer and maybe has gone into remission, one of the most common responses is the fear of it returning. Now, our brain naturally tends to think worst case scenario. So when you're seeing your clients, if you ask them questions like, where do you see yourself in 5 years' time? And if they have that fear that it might come back again, that fear, that energy can actually go into your body and actually make it worse for that person. So that energy is really important to acknowledge and recognise. And you can actually challenge that fear. So that part of the brain is the left part. Now the right part of the brain is our body and our feelings. So the left part really is the 10% conscious mind. The right part is the 90% unconscious. Everything that we experience, our body holds memories of it. So if you've got a person that's survived cancer, they will have memories, lots of memories, like even going to the hospital can create a huge amount of anxiety. It's because their body remembers the experience that they had there. And if it was an awful experience, like chemo can be very incredibly draining and incredibly debilitating, then clients can really be overwhelmed. So the right part of the brain is really where we need to be more than we should. We should aim to be in the right part of our brain as much as we can. So being in the now. Like activities that put you into the now are activities where you don't have a problem. Like for example, doing an activity like gardening, walking, where you're immersing yourself just in one activity, that actually is the area of the brain we need to be more in. Okay. So, body focusing. So as a part of emotion-focused therapy, one of the techniques that I find is incredibly powerful is body focusing. Perception of pain will impact on how you experience and feel the pain. So if you hate your pain, if you don't want, and look, who wants to have pain? Of course you're going to hate it. But if you can have some sort of acceptance of it, this pain is here for a reason. And I have a friend that has been in constant pain for about 20, 30 years, in her 70s. And she says to me that the way she handles that pain is that I pace myself. I know it's there, but I'm not going to let it stop me doing what I need to do in my life. So your perception of your pain is really important with how you experience it. So repressed emotions are stored in particular areas of the body. If you've had experiences in your life where you've been actually pushing your feelings down, there's 3 main areas of the body that you can have these emotions. And cancer survivors in particular, I find, do have these areas. Tightness in the throat, heaviness or pressure in the chest area, or even feeling sick in the stomach. They can actually feel really tight all over their body. If you ask them a question, just mention cancer, and that word can trigger off a physical reaction in the body. If it does make a reaction, that means that they have stored memories of that, of cancer in their body. So, the second brain, I've already mentioned it, I think, the gut. You know, when you know there's something not right, like I've had cancer patients say to me, look, I know I've got cancer, but you know what? I'm going to beat this, I know it. I just know it. I don't know whether you've experienced that yourself, but there's that gut knowledge, and that's the thing that we need to teach our kids, to follow the gut instinct. So I just want to give you a personal example of body focusing. I've got a friend teaching in southern China. When she came back to Australia for a holiday, and while she was here in Australia, a typhoon hit southern China and heaps of people were killed. When she went to go back to southern China, all of a sudden I got a tightness in my throat and I couldn't hardly breathe. It was like as if someone had their hands around my throat strangling me. Has anyone ever had an experience where they felt tightness in the throat? Can you just put your hand up? Anyone? And your reaction to that, when you get that, what do you do? Yeah, do you just try and breathe a bit more? Or you might distract yourself? Or you might think, oh my God, there's something really bad, something really wrong with me, I need to go to the doctor. But I knew this tightness was there for a reason. It was trying to tell me something. So this is the technique of body focusing I'm talking about. So what I did, I just closed my eyes. I let myself feel that tightness. Hello, tightness. I know you're here. I'm going to let you be here because you're here anyway. And I'm not going to try and work you out in my head. I'm going to get out of my head and into my body, because there's a message in here for me. So after about 2 minutes of just feeling that tightness and being totally open to it, a thought came up. And I knew it wasn't from here, I knew it was from here. I just knew it, I felt it. And the thought was, oh my God, she could have been killed if she had been over there in southern China. Now the thing is, when I heard about the typhoon hitting southern China, I didn't think to myself straight away, oh my God, she could have been killed. But my body remembered it. And the trigger for my body to remember it was her going back to southern China. So I learnt something really valuable by that experience of feeling the tightness. It was painful, but you know what? Another thought came up. Actually, the thought of her dying, I actually cried. I let myself cry. And I could feel the tightness just sort of leaving me at the end. And the last thought I had was, this pain that I'm feeling shows me how much I love her. Isn't that great? And so I rang her up and told her that. I would not have got that message if I hadn't listened to my body. And that's what, as human beings, we need to do more of that. Listen to our body, because our body holds the answers if we are willing to listen. That's the thing. Are we willing to listen? So, common psychological traps. Holding back the tears. Really big one. See this as weakness. This is not weakness. Sign of great strength. And actually our tears have got the actual chemical in our tears is called leucine, and maybe the GPs can help me with the name, enkephalin, an endorphin that reduces pain and works to improve mood. So tears are our natural type of sedative, I suppose. It'll make you feel good. And we have this perception in our society that it's not okay to cry. But it's one of the things, particularly when you're faced with life and death and dying, it's really important to acknowledge the feelings that you're having and particularly sharing them with your loved ones. Yeah, so not asking for help is another psychological trap. You know, I'm going to be strong. I'll do it on my own. I don't want to bother anyone else. They've got enough on their plate. They've got enough to do. We really need to, as a human beings, we need that social connection, and we need that group that can actually, you know, guide us and help us and love us and keep us going. That's so important. And carers. How many carers actually lose themselves while they're caring for others? They are so busy helping their loved ones that they forget their own needs and they become so overwhelmed. What can happen is carers can actually die before the person that they're caring for dies. And this is a really big area that I think that as a society we need to be looking out for people that actually have signs of burnout. And one of the signs that I see is that they're so busy and they can't stop. They cannot stop and they cannot relax. And when you ask them what do they feel in their body, they feel nothing. Because they're actually running on fear. They're so scared that their loved one's going to die that they feel that they have to keep going so I don't have to feel all this stuff that I'm feeling inside here. Imagine what happens to them in your body, tightens up, the fear is very constricting, and it can lead to lots of physiological illnesses. So, the one secret to leading a fulfilling life, a Harvard study. Does anyone know of that one? Anyone heard of this? Yeah. Okay, so this was a 75-year-old Harvard study. And, okay, so what they did, they tracked the physical and emotional well-being of two populations, 456 poor men growing up in Boston from 1939 to 2014, and then 268 male graduates from Harvard classes 1939 to 1944. So there was multiple generations of researchers. So they were analysed, their blood samples were analysed, they conducted brain scans and pored over self-reported surveys as well as actual interactions with these men to compile their findings. And there was one thing that they came up with that was overwhelmingly the most important thing in terms of leading a fulfilling life. So let's have a look at that. First of all, before we do the answer, so this study demonstrates having someone to rely on helps your what to relax, do you think? And particularly your nervous system. Because when your body is in fear and in fright and anxious, your body tightens up, it constricts. And you're holding. So if you're holding constantly, what do you think is going to happen over time? Your body can't take it. There's a point where it has to crash. So, helps your, what do you think, stay a lot healthier for longer? The brain. And reduces both what sort of pain? What do you think? Yes, and emotional. Such a strong link between the physical and the emotional, and we forget that. The data, I'm just going to skip that the second one there and say, go to the data. The data is also very clear. For those that feel what? Are more likely to see. What do you think that word is there? Who feel what? And think about us as social beings. As human beings, we are meant to be in a tribe. Lonely, yes. Yeah, we're in the internet age, but we are more lonely than ever. Are more likely to see their health decline earlier and die younger. Their physical health. So the biggest predictor of your happiness and fulfilment in your overall life is love and connectedness. Good relationships keep us happier and healthier. So when we're faced with an incredibly distressing situation in terms of cancer, it's so important to have the tribe around you and that you actually share your pain with each other. So important. I think it goes to the next one. Okay. So, the take-home messages. This quote comes from, it would have come from this book, I think, yes, When the Body Says No. No, actually it comes from the Harvard study. So it's not, like we talk about, it's not the number of friends you have, whether you're in a committed relationship or whether you have a huge group of friends and you go out every weekend. It's the quality of the relationship, how much vulnerability and depth exists within them. So when you're feeling really sad, you need to share the pain with your loved one. You need to actually cry with your loved one. Walter Micak, founder of Alana and the Madeline Foundation, I heard him at an interview, radio interview, and he was the guy that lost his wife and daughter in the Port Arthur massacre, and he set up this foundation to fight domestic violence. And they asked him, how on earth did you cope with something like that? And he said that the single biggest thing that helped him was that he shared his pain with his loved ones and he cried with them. When you cry with your loved ones, you bond together. That energy just gets immersed and you know that no matter what happens, you've always got someone there. So if someone does die, you've always got someone else there helping you get through it. And the body remembers everything. Absolutely everything. So if you have a client, in terms of with cancer, and the fear is this is going to come again. If you live your life fearing that it's going to happen, it more than likely will. Not always, but you're not living your life fully if you're fearing that it's going to happen. You're so much better off to be in the right part of your brain and be in the moment and love life. I had a cancer survivor say to me, Alice, you know what? The best thing that ever happened was when I got cancer, because I don't worry about that small stuff anymore. And I truly live my life every day. So I didn't finish off that top sentence up there. I didn't finish the sentence. How safe you feel sharing with one another. The extent which you can relax. Oh my God, how many of us can actually relax now? Always doing. Never just being. Human beings, we are meant to just be. We're meant to be in the right side and not into that monkey brain all the time. And so you need people around you that see you who you truly are and you truly see another. So sharing your pain with others is an incredibly powerful antidote. Walter Micak, he said that was the most important thing that he did, which is pretty incredible. Okay. So, life's amazing journey. Lunik, don't you love him? So that's what life's about. It's up and down. And if we can actually show our clients that life does bring us curveballs sometimes, but if we have people around us that truly love us and that we are truly connected, then we're going to be okay. Okay? Thank you.